The Medicare lie that steals your money forever, the lifetime penalty trap. You've been told you can wait on Medicare, miss the wrong date by a month, and you'll pay extra every single month, for life. That's the trap. The penalties stack on Part B and Part D, and they never time out. In the next few minutes, I'll show exactly how these penalties work, who's actually at risk, and the simple moves that avoid them. We'll decode the clocks, the forms you need, and the key exceptions that save late retirees thousands. Quick map. Part A is usually premium-free. Part B is medical. Part D is drugs. The penalties hit B and D. Let's get practical fast. The problem: why late enrollment penalties exist and why they blindside people. Medicare didn't invent penalties just to be mean. The point is to stop people from waiting until they get sick, then jumping in only when the bills get big. That behavior spikes costs. So Medicare deeters it by charging more permanently if you sign up late without qualifying coverage. That's the why. Here's what most people miss. There are two separate penalties with separate clocks. Part B, your medical insurance, adds 10% to your premium for every full 12 months you were eligible but not enrolled and didn't have a qualifying reason to delay. That 10% stacks for life. Part D, your drug coverage, adds 1% of the national base beneficiary premium for every full month you lacked Part D or creditable drug coverage after you were first eligible, and that's also for life. The base changes each year, so the Part D penalty can creep up. Now, why do smart, organized people still get hit? Because the rules aren't intuitive, and employer coverage creates a false sense of safety. You might think, I've got insurance through work, so I'm fine. Maybe, but only active employer coverage from a large employer lets you delay Part B without penalty. Large means 20 or more employees for at least 20 weeks in the current or prior year. Under 20, Medicare is primary at 65, and your group plan is secondary. If you skip Part B there, your employer plan can deny or reduce payment, and you rack up a Part B penalty. That's the small employer trap. Another blind spot is COBRA. COBRA feels like employer coverage, but it isn't active coverage. It does not protect you from the Part B penalty or create a Part B special enrollment period. If you retire, take COBRA, and delay Part B, you can be stuck paying the penalty and even face coverage gaps. Same idea with retiree coverage and union plans. Many do not count as active coverage for Part B timing purposes. You still need Part B on time unless you're actively working for a large employer or covered under a spouse who is. For Part D, the trap is creditable coverage. Your drug coverage must be at least as good as Medicare's standard drug coverage. You're supposed to receive a letter each year confirming whether it's creditable. Keep those letters. If you go 63 days or more without Part D or creditable drug coverage, you start accruing the Part D penalty 1% per uncovered month. Discount cards, some retiree plans, and COBRA drug coverage frequently don't meet the standard. Assumptions here are expensive. Let's talk enrollment windows. At 65, you get a 7-month initial enrollment period, 3 months before your birthday month and 3 months after. Enroll early for a smooth start. If you keep working at a large employer and stay on the group plan, you can delay Part B and D. When that active coverage ends, you get a special enrollment period, generally 8 months for Part B and 63 days for Part D to enroll without penalties. Miss those windows, and you may be stuck waiting for the general enrollment period for Part B, which runs January 1st through March 31st, with coverage starting the 1st of the next month. That delay can mean uncovered time and more penalty exposure. Mid-year retirements are another gotcha. If you retire in, say, June, but don't file your forms until late summer, you can create a gap that triggers penalties. HR departments, while helpful, sometimes assume employer coverage equals protection. It doesn't unless it's active and large. Always verify. Active versus retiree, employer size, and creditable drug status. The lifetime impact is what stings. Part B penalties are calculated on the base premium and then added on top of what you pay, including any income-related surcharges. As the base premium rises over time, your penalty dollar amount rises too. Part D penalties ride the national base, which also changes annually. So delay today becomes higher costs tomorrow, every month, for as long as you have Medicare. The fix starts with clarity. Know which coverage counts, know your dates, and gather proof. In the next section, we'll break down Part B's math and timing so you can run your numbers with confidence. Part B penalty demystified, the exact math and timing. If you remember nothing else about Part B, remember this: the penalty is 10% for every full 12 months you could have had Part B, but didn't, and it lasts for life. It's calculated on the standard Part B premium, then added to whatever you actually pay, including any IRMAA. As the base premium goes up over time, the dollar amount of your penalty goes up too. That's why small delays become big, permanent costs. Now let me show you exactly when the clock starts and stops. The penalty only counts full 12-month periods of non-enrollment when you were eligible. Partial years don't count toward the 10%. Your eligibility generally begins the first day of the month you turn 65. If your birthday is on the 1st, eligibility starts the month before. From there, Medicare gives you a 7-month initial enrollment period. 3 months before your birthday month, and 3 months after. Here's where most people mess up. Enrolling during the last 3 months of your initial enrollment period can delay your start date. That can create coverage gaps. And if you don't have qualifying active employer coverage, it can push you into penalty territory once a full year passes. The shortcut: if you're planning to enroll at 65, file in the first 3 months. So your Part B starts the first day of your birthday month. If your birthday is on the 1st, it starts the month prior. What if you're working past 65? This is where the special enrollment period comes in. If you have active group health coverage through your employer or your spouse's employer, and that employer has 20 or more employees, you can delay Part B without penalty. When that active coverage ends, you get an 8-month special enrollment period to enroll in Part B penalty-free. Critical detail: COBRA and retiree coverage don't count as active. They don't create a Part B special enrollment period, and they don't protect you from the penalty. Counting rules get easier with examples. Case 1, on-time enrollment. You turn 65 in July, you apply in April, and Part B starts July 1st. 0 penalty. Case 2, a 1-year miss without qualifying coverage. You turn 65 in July 2023, you don't enroll, and you finally sign up during the general enrollment period in March 2025. Your first full 12 months of non-enrollment ended June 30th, 2024. That's 1 full year, so your penalty is 10% for life, starting the month your Part B begins. If you kept waiting and crossed 2 full years before you enrolled, the penalty would be 20%, and so on. Now, the general enrollment period matters. If you miss your initial enrollment period and you don't qualify for a special enrollment period, you can only sign up January 1st through March 31st, with coverage starting the 1st of the next month. That waiting window can still create uncovered time. The fix is to avoid needing the general enrollment period by planning your enrollment around either your initial enrollment period or a valid special enrollment period. Here's the small employer trap with real timing. You're covered by an employer plan at a 12-person company, and you turn 65. Medicare becomes primary at 65 because the employer has fewer than 20 employees. If you delay Part B, your group plan can pay as secondary or even deny. Worse, you're already racking up penalty time because you didn't have an acceptable reason to delay. In that scenario, The safe move is to enroll in Part A and Part B during your initial enrollment period so Medicare is primary and you don't start the penalty clock. What proof do you need when you use the special enrollment period? 2 pieces. First, the Part B application, CMS 40B, where you can state, I want Part B to begin, and the month you want. Second, proof of active group coverage tied to current employment, ideally the CMSL 564 employer verification form. If your employer won't complete it, Social Security accepts other evidence, pay stubs showing insurance deductions, plan ID cards with effective dates, or explanations of benefits. Submit those with your CMS 40B. That documentation prevents disputes about whether you qualify for penalty-free enrollment. Common mistakes to avoid: relying on COBRA to delay Part B, assuming a retiree plan counts as active, believing any employer size protects you, and filing late in your initial enrollment period expecting instant coverage. The better method is simple. Either stay continuously covered by Medicare Part B or have active large employer coverage. Then switch to Part B within 8 months of that coverage ending. Quick when you can get today. Check your employer size and status. Ask HR, is our plan primary or secondary to Medicare at 65? Do we have 20 or more employees for at least 20 weeks this year or last? Is my coverage based on active employment? If the answers don't line up, enroll in Part B now to stop the penalty clock. Part D penalty demystified, creditable coverage, or pay forever. Part D is sneakier than Part B because it looks small per month and then never goes away. The penalty is 1% for every full month you went without Part D or creditable drug coverage after you were first eligible. It's calculated on the national base beneficiary premium, and you pay it as long as you have Medicare drug coverage. The base can change every year, so your penalty dollars can rise over time. Why does this sting? Because people think, I don't take meds, I'll sign up later. The thing most people miss is the 63-day gap rule. If you go 63 days in a row without Part D or creditable drug coverage, your penalty clock starts. 1 week over that line can cost you for life. The quick win is simple. Keep continuous creditable drug coverage or join a low-cost Part D plan to hold your place. So what actually counts as creditable? It's drug coverage that's expected to pay, on average, at least as much as standard Medicare Part D. Employers and unions must tell you each year if their drug coverage is creditable. You'll usually get a letter each fall. Keep those letters forever. Scan them. If you don't get a letter, check your benefits booklet or call the plan and ask for written confirmation. Without proof, you'll struggle to overturn a penalty later. Now, here's where most people mess up. COBRA drug coverage often feels good, but it can be non-creditable, and it does not protect you from the 63-day clock once your active coverage ends. Discount cards and pharmacy savings programs don't count at all. Some retiree and union plans are creditable, some aren't, and it can change year to year. VA drug coverage is creditable for Part D, but if you rely on VA only, make sure your access is realistic. TRICARE for life generally includes creditable drug coverage, but still keep your annual notice. The enrollment timing is straightforward once you see the pattern. At 65, during your initial enrollment period, you can enroll in a Part D plan, or you can delay if you have creditable drug coverage. When that creditable coverage ends, you get a special enrollment period for Part D. The critical detail is the 63-day limit. You must enroll in a Part D plan within 63 consecutive days after your creditable drug coverage ends to avoid the penalty. Don't ride that deadline. Enroll as soon as the old coverage ends. Let me show you exactly how the math plays out. Medicare multiplies 1% by the number of full uncovered months, then multiplies that by the national base beneficiary premium, and rounds to the nearest 10 cents. If you had a 14-month uncovered gap you owe 14% of the base added to your monthly plan premium for life. If the base goes up next year, your penalty dollars can go up too. That's why a short delay compounds. Here's a common scenario. You retired June 30th. Your active employer coverage ended that day, and you took COBRA. You assumed the COBRA drug coverage was creditable, but it wasn't. You didn't enroll in Part D until the fall. You just crossed 63 days, so you started a lifetime penalty. This is avoidable if you verify creditable status in writing before you retire and line up a Part D plan to start the day after your active coverage ends. Another one, you're on a retiree plan with drugs. It was creditable last year, but this year the plan changed, and the notice says non-creditable. If you miss that letter and let 63 days pass without enrolling in Part D, you'll owe a penalty when you finally sign up. The fix is to read the fall notice and move to a Part D plan right away if the retiree drug coverage loses creditable status. Proof matters. Save every annual creditable coverage notice. If your plan didn't send it, request a written letter. If you're ever assessed a penalty you think is wrong, those documents are your ticket to appeal. Without them, you're relying on plan records that may be slow or incomplete. Quick how-to for a clean transition. Step 1, 90 days before retirement. Ask HR in writing, is our drug coverage creditable for Medicare Part D next plan year? Step 2, request the creditable coverage letter and keep it. Step 3, if you're losing creditable coverage, shop a Part D plan and set it to start the first day after your employer coverage ends. Step 4, confirm enrollment and keep your plan confirmation letter. Common mistakes to avoid. Thinking no prescriptions means you don't need Part D, assuming a savings card counts, waiting until the annual enrollment period if you already lost creditable coverage, and ignoring the 63-day countdown. The better method is to keep proof, enroll promptly, and use the special enrollment period as soon as creditable coverage ends. If you remember nothing else about Part D, verify creditable coverage every fall, keep the letter, and never let 63 days pass without either a Part D plan or documented creditable drug coverage. That one habit saves you from paying extra every month for life. Avoidance Blueprint, the cleanest path that works in most situations. Prevention beats appeals every time. The clean path is boring on purpose. Keep continuous qualifying coverage, verify it in writing, and line up here. Medicare start dates before anything ends. Do this, and you'll never see a penalty letter. Here's the simple rule set that works for most people. For medical, either stay on active group health coverage from a large employer, 20-plus employees, or be enrolled in Part B. For drugs, either keep creditable drug coverage in force or be enrolled in a Part D plan. No gaps, no guessing, no penalties. Let me turn that into a checklist you can actually follow. At 64 and a half, start your prep. Ask HR 3 questions in writing. Is my coverage based on active employment? How many employees are there? 20 or more for at least 20 weeks this year? Or last, is our prescription drug coverage creditable for Medicare? Request 2 documents, the CMS L564 Employment Verification Form completed when you retire, and the annual creditable coverage notice for your drug plan. Start a Medicare proof folder and scan everything. At 65, decide your default. If you work for a small employer under 20, enroll in Part A and Part B during your initial enrollment period. Medicare is primary. Add a Part D plan unless you have written proof of creditable drug coverage. If you work for a large employer and want to delay Part B, confirm your plan is primary to Medicare. Keep the creditable drug letter and calendar reminders to repeat this check every fall. In your retirement month, timing is everything. You want your Medicare start date to be the first day after your active employer coverage ends. 90 days before your retirement date, submit your CMS 40B with I want Part B to begin and the exact month and line up the CMS. L564 with HR. For Part D, pick a plan and set the start date to the day after your active drug coverage ends. Don't wait for the annual enrollment period. If your creditable coverage is ending, use your special enrollment period. The thing most people miss is that HR language can be fuzzy. You're covered doesn't tell you if the plan is primary to Medicare or if drugs are creditable this year. Your safety net is written proof. If HR can't or won't fill CMS, L564 fast enough. Use backups, pay stubs showing health deductions, an ID card with effective dates, explanations of benefits. Social Security accepts those as evidence of active group coverage. Attach them to your CMS, 40B, and keep copies. Mid-year retirements need a clear timeline. Here's the shortcut. T-minus 90 days. Verify employer size, active status, and creditable drug status. Request CMS. L564. Enroll in Part D for the first month after work coverage ends. T-minus 60 days. Submit CMS 40B and include your requested Part B start month. Confirm your Part D plan selection and mail order setup if you use it. T-minus 30 days. Reconfirm end dates with HR, pick a Medigap or Advantage path if you're going that way, and capture all final letters. Day 1 after coverage ends. Confirm Part B and Part D are active. Call the plans if you don't have confirmation. Before we continue, you need to understand the default when you're unsure. If you cannot get timely proof that your employer coverage is active and primary or that your drug coverage is creditable, enroll. Enroll in Part B to stop the Part B penalty risk. Enroll in a low-cost Part D plan to stop the 63-day drug penalty clock. You can always adjust plans later. You can't erase penalty months later. Here's a quick micro story. A client planned to retire in August. HR said, "You're fine until September." That sounded safe, but the drug coverage lost creditable status July 31st. Because we had asked for the letter early, we caught it in June, enrolled her in a $6 Part D plan for August 1st, and saved her a lifetime penalty. The difference was one email asking for creditable in writing. Common mistakes to avoid. Waiting to enroll in Part B until COBRA ends. Assuming retiree coverage creates a special enrollment period. Trusting a verbal "we have 20 employees" without counting part-timers and seasonal rules. And forgetting that your spouse's employer size, not yours, governs your spousal coverage. The clean path avoids all of that with documents and dates. If you remember nothing else, verify active and creditable in writing, line up Medicare to start the day after your employer coverage ends, and keep proof in a folder. That's the blueprint that quietly saves you thousands for life. Special cases, working past 65, COBRA, retiree plans, and the small employer trap. Let's get precise about edge cases, because this is where good people lose money. Working past 65 sounds simple. Keep your job, keep your insurance, but the details decide whether you can safely delay and whether Medicare or your employer plan pays first. Start with employer size. If your or your spouse's employer has 20 or more employees for at least 20 weeks in the current or prior calendar year, that's a large employer. In that case, the group plan is primary while you're actively working, and you can delay Part B without penalty. When that active coverage ends, you have an 8-month special enrollment period for Part B. That's the safe, clean path. Now, the small employer trap. If the employer has fewer than 20 employees, Medicare is primary at 65. Your group plan is secondary. Delay Part B here, and you're exposed. Claims can be denied or paid, as if Medicare had already paid. You also start building a Part B penalty clock because you don't have a protected reason to delay. The fix is simple. If you're at a small employer, enroll in Part A and Part B during your initial enrollment period so Medicare is in place as primary. Active versus retiree coverage is another critical line. Only coverage based on current, active employment creates a Part B special enrollment period. Retiree coverage does not. It might look identical on your insurance card, but for Medicare timing, it's not the same. If you retire at 65 and keep a retiree plan without enrolling in Part B, you can rack up penalties and get stuck until the general enrollment period. The safer move is to enroll in Part B when you retire unless you're staying on truly active, large employer coverage. Let's talk COBRA. COBRA feels like a cushion, but it does not count as active coverage for Part B. It does not create a Part B special enrollment period. If you take COBRA and delay Part B, you risk penalties and gaps. Even worse, enrolling in Medicare after COBRA starts can cause your COBRA to end. Bottom line, don't use COBRA to delay Part B. If you're retiring, line up Part B to start the day after active coverage ends, and only then consider COBRA for dental/vision or for a spouse's continuation needs. Drug coverage has its own traps. Some retiree and union plans are creditable for Part D, some aren't. That status can change each year. You must get and keep the annual creditable coverage letter. VA drug coverage is creditable for Part D, and TRICARE for Life generally includes creditable drug coverage, but confirm annually. COBRA drug coverage can be creditable or not. Don't assume. If you lose creditable drug coverage, you have 63 days to enroll in Part D to avoid a lifetime penalty. Don't wait for the fall. Use your special enrollment period immediately. Spousal coverage adds one more wrinkle. If you're on your spouse's plan, the employer size that matters is your spouse's employer, not yours. If your spouse works for a small employer under 20, Medicare is primary for you at 65, even if your own employer is large or you're not working. That's a common coordination gotcha. Ask the spouse's HR directly. Is our plan primary or secondary to Medicare for covered dependents 65 plus? Here's a clean checklist to sort your situation fast. 1. Confirm employer size in writing, 20 or more for at least 20 weeks this year or last. 2. Confirm your status, active employee versus retiree or COBRA. 3. Confirm who's primary. Ask, is our plan primary to Medicare for age 65 employees and spouses? For confirm drug creditable status, get the letter. 5. Line updates. If active coverage ends, Part B must start the next day. Part D must start within 63 days. Microstory to make it stick. A client at a 17-employee firm turned 65 and kept the group plan without Part B because HR said you're fine. Claims started getting reduced because Medicare should have paid first. By the time we fixed it, he owed a permanent 10% Part B penalty, one accurate head count, and a timely Part B application would have saved him every month for life. Common mistakes to avoid. Counting contractors as employees without checking how the employer counts for Medicare rules. Assuming COBRA buys you time on Part B. Thinking retiree plans create a special enrollment period. Ignoring spousal employer size. And waiting for the annual enrollment period after losing creditable drug coverage. Each of those choices can turn into lifetime penalties. If you're stuck today, pick the default that stops the bleeding. Enroll in Part B if you can't verify active, large employer primary coverage. Enroll in a low-cost Part D plan if you can't verify creditable drug coverage. Then collect documents. CMSL 564 from the employer when possible, pay stubs, plan IDs, and creditable letters to support any penalty reconsideration. Dates, proof, and fast action turn special cases from traps into smooth transitions. Paper trail power, the documents that save you thousands. Here's the shortcut nobody teaches. Your paperwork is your penalty shield. If you can prove you had active group health coverage and creditable drug coverage at the right times, you get smooth special enrollment periods and, if needed, real shots at reconsideration. If you can't, you risk paying for years while you argue. Why proof matters. Social Security needs evidence to grant a Part B special enrollment period and to waive penalties tied to late enrollment. Plans need evidence to remove a Part D late enrollment penalty. Without documents, everyone defaults to penalty applies. With documents, doors open. What to keep specifically? For Part B, keep the CMS 40B, your Medicare Part B application, and the CMS L564, Request for Employment Information. CMS L564 is the gold standard because it confirms your coverage was based on current employment. For Part D, keep every annual creditable coverage notice from your employer, union, VA, or TRICARE. Save plan confirmation letters showing start and end dates for any coverage that counts. Now, how to use them? When you're leaving active employment with a large employer, complete CMS 40B and ask HR to complete CMS L564. On CMS 40B, write, "I want Part B to begin," and list the first month after your active coverage ends. Attach CMS L564 and submit to Social Security. If HR drags, don't stall. Submit CMS 40B and include backup proof. Pay stubs showing health deductions, insurance ID cards with effective dates, explanations of benefits showing claims paid, and an HR email confirming your active coverage and end date. SSA accepts alternative proof when CMS L564 isn't available right away. For Part D, make the creditable letters do the heavy lifting. If a plan ever flags you for a drug penalty and you had creditable coverage, send the letter that covers that exact period. If you don't have the letter, call the former plan or employer and request a written statement confirming creditable status and your coverage dates. Plans are required to provide this. Keep copies of pharmacy ID cards and benefits booklets. While not as strong as the letter, they help. Timing is everything. Request CMS L56460 to 90 days before your retirement date. So HR has runway. Ask for your current year drug creditable letter each fall, and again when you announce retirement. If you're mid-year, get a written end date for both medical and drug coverage. Submit your Part B and Part D enrollments to start the day after those end dates. The goal is 0 gaps. Backup strategy if you've lost documents. Rebuild the record. Start with HR. Ask for an employment verification letter and plan participation dates. Pull pay stubs for any month you paid the employer plan. Highlight the deduction. Print plan IDs with effective dates from your portal. Ask the plan for explanations of benefits from the months before you retired to show active coverage. For drugs, contact the plan's benefits office and request a retroactive creditable coverage confirmation. Scan everything to a single PDF and label it Medicare SEP proof. Your name. Common mistakes to avoid. Waiting on HR before you file CMS 40B, tossing the annual creditable letters, assuming a plan will find the data, and mailing originals without keeping copies. Don't do that. Submit copies, keep digital scans, and track delivery. If you fax, keep the confirmation page. If you upload, screenshot the submission confirmation. If you remember nothing else, 2 forms for Part B, CMS, 40B plus CMS, L564, and 1 letter for Part D, your annual creditable coverage notice. Get them early, store them forever, and your Medicare timing stays penalty-proof. If you're already late, damage control and appeal paths. If you're already late, don't freeze. Every uncovered month can increase what you pay, so the first goal is to stop the clock. The cleanest move is to enroll in the earliest window available to you right now. For Part B, that's usually the general enrollment period if you don't qualify for a special enrollment period. For Part D, enroll immediately using the special enrollment period if you recently lost creditable coverage, or the next available enrollment window if you didn't. Let me show you the fast triage. Step 1. Figure out if you qualify for a Part B special enrollment period. Did you have active employer coverage from a large employer that ended within the last 8 months? If yes, you likely have a Part B SEP. File the CMS 40B application and attach proof of active coverage, ideally CMS L564 from your or your spouse's employer. If HR won't complete CMS L564 quickly, submit alternative proof, pay stubs with health deductions, insurance cards with effective dates, or explanations of benefits. The reason this works is Social Security accepts other evidence if the employer form isn't available. If you do not qualify for a Part B SEP, use the general enrollment period. Enroll between January 1st and March 31. Coverage starts the 1st of the next month. That start date matters because it stops additional uncovered months from piling up. Don't wait for a better time. Waiting usually adds penalty months and leaves you exposed for claims. For Part D, ask one question. Did you lose creditable drug coverage within the last 63 days? If yes, that creates a special enrollment period for Part D. Enroll in a plan now. Do not wait for the fall. If you're over 63 days, enroll anyway to stop more months from accruing. You can always appeal the penalty later with proof. You can erase months you keep adding. Now, let's talk reconsiderations and appeals. For Part B penalties, your best path is to enroll first, then submit a penalty reconsideration to Social Security if you had a valid reason or bad information. Strong cases include written employer misadvice that said you could delay Part B, delays outside your control, or administrative errors where forms were mishandled. Attach evidence. Emails from HR, dated letters, pay stubs, and any CMS L564 you can obtain retroactively. You're asking for reconsideration of the penalty, not permission to keep delaying. Stopping the clock comes first. For Part D penalties, plans must follow Medicare's rules. After you enroll, your plan will notify you if they think a penalty applies. If you disagree, file a late enrollment penalty reconsideration through the plan. The plan forwards it to an independent reviewer. Strong grounds include proof you had creditable drug coverage for all or part of the period, or evidence you received inadequate information about whether coverage was creditable. Use the annual creditable letters, employer statements confirming creditable status, and coverage dates. Keep paying the assessed LEP while the appeal is reviewed. If you win, the plan will adjust and refund as applicable. Here's a quick order of operations to stop bleeding and build your case. 1. Enroll in Part B at the first possible window. SEP if eligible, otherwise GP. 2. Enroll in Part D right away. If you lost creditable coverage recently, use that SEP. 3. Assemble documentation, CMS, L564 if possible, alternative proof of active coverage, creditable drug letters, plan IDs, and HR emails confirming dates. 4. Submit reconsiderations, Part B penalty reconsideration to Social Security, Part D LEP reconsideration through your Part D plan. 5. Track everything, dates, receipts, and responses. Common mistakes to avoid right now. Waiting for HR to finish CMS L564 before you file CMS 40B, assuming COBRA creates a Part B SEP, ignoring the 63-day Part D clock while you research plans, and stopping LEP payments during appeal. Don't do any of that. File, enroll, pay what's due, and build the record. Microstory to make it concrete. A viewer retired in April, took COBRA, and delayed Part B. By October, claims were bouncing. We enrolled him in Part B during GP, set coverage to begin the next available month, enrolled him in a low-cost Part D plan immediately, then gathered pay stubs and an HR email showing his coverage had been active until retirement. His Part B penalty stuck for 1 full year of delay, but the reconsideration removed 2 disputed months the carrier miscounted. For Part D, the retroactive creditable letter wiped the LEP entirely. The difference was enrolling first and documenting second. If you remember nothing else here, act fast to stop penalty clocks, then appeal with proof. Enroll in Part B at the earliest window you can reach. Enroll in Part D before day 63 if you lost creditable coverage, or as soon as possible if you're past it. Use CMS, 40B plus CMS, L564 or acceptable substitutes, and use your annual creditable letters to challenge any drug penalty. Dates and documents win these fights. The IRMAA connection, how income-based surcharges amplify mistakes. Now we need to layer an IRMAA because this is where small timing errors get multiplied. IRMAA is an income-based surcharge that sits on top of your Part B and Part D premiums. Social Security looks back 2 tax years to your modified adjusted gross income. If that number crosses a tier, they add a monthly surcharge for the whole calendar year. And here's the kicker, your late enrollment penalties stack on top of IRMAA. If you trigger both, you're paying more in 2 ways, permanently for the penalty and annually while your income keeps you in a higher tier. Why does this matter when you're retiring? Because retirement is when people compress income. Roth conversions, severance, unused vacation payouts, RSU vesting, annuity startups, and first-year required minimum distributions can all hit in the same calendar year you enroll. If that year is the one Social Security uses for the 2-year look-back, you can get bumped into IRMAA right as you start Medicare. Combine that with a Part B or D penalty, and the monthly damage is real. Here's the simple model. Your base Part B premium is set each year. If you're in an IRMAA tier, Social Security adds a surcharge. If you also owe a Part B penalty, Medicare calculates that penalty as a percentage of the base premium and adds it on top of whatever you actually pay, including IRMAA. So the penalty rides along, and the IRMAA sits underneath as a separate layer. For Part D, it's similar. You pay your plan premium, the plan adds any late enrollment penalty and Social Security bills, IRMAA, separately if you're in a higher tier. The thing most people miss is sequencing. If you can control when income hits relative to when you enroll, you can sometimes avoid triggering IRMAA at the same time you're fixing a late enrollment issue. The better order is secure coverage first, enroll in Part B and Part D on time, or as soon as possible, then plan any elective tax moves like Roth conversions. Don't pile income into the same tax year that the 2-year look-back will use for your first Medicare premiums. If you can help it, what if you already spiked your income and now IRMAA shows up on your letter? There's a path, the life-changing event appeal. If your income has gone down due to a qualifying event, retirement, reduced work hours, marriage, divorce, or the death of a spouse, you can ask Social Security to use a more recent tax year. This can lower or remove IRMAA for the current year. The practical how-to. File Form SSA 44, check the event, estimate your new lower income, attach proof like a retirement letter or pay stubs, and submit. If approved, your IRMAA is adjusted going forward, and sometimes retroactively. Let me show you a clean timeline that avoids stacking errors. 90 days before retirement, lock your Medicare dates. Part B and Part D start the day after active coverage ends. Pause on large voluntary income moves until you're sure of your IRMAA exposure. After your first Medicare premium notice arrives, decide if you'll appeal IRMAA using the life-changing event route. If your appeal is likely to succeed, file it first. Then, plan any conversions or distributions in a tax year that won't feed the 2-year look-back used for your upcoming Medicare year. A quick micro-story. A couple retired in June and planned a $150,000 Roth conversion in December before taxes go up. Their first Medicare year used income from 2 years prior, which was already high. The conversion didn't affect that first IRMAA year, but it did spike the next one. We resequenced. They filed the life-changing event appeal for the current year based on retirement, won the reduction, then staged conversions across later years to stay under IRMAA thresholds. Same tax goal, thousands saved in surcharges. Common mistakes to avoid. Doing a large Roth conversion in the same year you lose active coverage, assuming IRMAA is fixed and can't be appealed after retirement, ignoring that penalties stack on top of IRMAA, and delaying enrollment while you finish tax planning. Don't do that. Coverage first to stop penalties, then appeals, then smart, staged income. If you remember nothing else, IRMAA is a separate surcharge that can be reduced with a life-changing event appeal after income drops, but your late enrollment penalties won't go away. Enroll to stop penalty clocks, then control when income shows up. So IRMAA doesn't amplify the damage. Your 12-month action plan, dates, deadlines, and decisions. Dates win. A written plan stops last-minute mistakes, ends guesswork, and keeps you penalty-proof. I'll walk you month by month from age 64 and a half through your first retirement year, so you always know what to do next. Month minus 12 to minus 10, around age 64 and a half. Start your file. Create a digital Medicare-proof folder. Email HR 3 questions. Is my coverage based on active employment? How many employees? 20 or more for at least 20 weeks this year or last? Is our prescription drug coverage creditable for Medicare Part D next plan year? Ask for written answers. Request a blank CMSL 564. So HR knows you'll need it at retirement. Set calendar reminders for your initial enrollment period dates and for each fall's creditable coverage notice. Month minus 9, confirm your birthday rule. If your birthday falls on the first of the month, your Medicare eligibility starts a month earlier. Adjust your IEP reminders accordingly. If you're at a small employer under 20, decide now to enroll in Part A and Part B during your IEP. If you're at a large employer and plan to delay Part B, confirm the plan is primary to Medicare while you're actively working and reconfirm drug creditable status in writing. Month minus 8, audit dependents. If you're on a spouse's plan, verify the spouse's employer size and who's primary at age 65. Ask their HR directly. If Medicare will be primary for you, plan to enroll in Part B during your IEP regardless of your own employer. For drugs, request last year's creditable letter if you don't have it. Missing documents now is a warning to tighten your paper trail. Month minus 7 to minus 6, price your path. If you'll enroll at 65, compare Medigap versus Advantage. And shortlist options. If you'll delay Part B on active large employer coverage, confirm you'll still keep creditable drug coverage or plan a low-cost Part D if creditable status is uncertain. Add a reminder to ask for the current fall's creditable notice as soon as it's issued. Month minus 5. If you're enrolling at 65, plan your filing week. Filing in the first 3 months of your IEP ensures the cleanest start. Draft your CMS 40B notes. I want Part B to begin plus the month you need. If small employer or no qualifying coverage, lock this in. Month minus 4 to minus 3. File if you're enrolling at 65. Submit your Medicare application so Part B starts on time. Pair it with a Part D plan unless you have documented creditable drug coverage. If delaying on active large employer coverage, do nothing on Part B yet, but save the new creditable drug letter when it arrives in the fall. Month minus 3. If you're targeting retirement within the next year, pencil a retirement month and reverse engineer dates. Your goal: Part B starts the first day after active coverage ends. Part D starts no later than day 1 after creditable drug coverage ends. Month minus 2. Pre-retiree steps. Request HR to complete CMSL 564 with your coverage end date. Line up backups in case HR is slow. Pay stubs showing health deductions, plan ID cards with effective dates, EOBs, and an HR email stating active coverage through date. Compare Part D plans and pick one to start the day after active drug coverage ends. Month -1. File CMS 40B with your requested Part B start month, attach CMS L564 or your backup proof, and submit to Social Security. Enroll in your selected Part D plan to start immediately after your employer drug coverage ends. If you're keeping VA or TRICARE and relying on it, ensure you have the current creditable letter on file. Retirement month. Confirm termination dates for medical and drug coverage in writing from HR. Verify Part B shows an effective date of the day after employer coverage ends. Verify your Part D plan. Start date. If there's any mismatch, call immediately. Fixing it now avoids uncovered days that trigger penalties. Month +1. Check claims and ID cards. If you took COBRA for dental/vision or dependents, remember COBRA is not active coverage for Part B. Do not delay Part B because you took COBRA. For drugs, if you used COBRA temporarily, confirm whether it's creditable. If not, ensure your Part D is active. Month +2 to +3. Build your annual routine. Each fall, request and save the Part D creditable coverage notice. If a retiree or union plan loses creditable status, switch to a Part D plan immediately. Don't wait for the annual enrollment period if your SEB is open due to loss of creditable coverage. Month +4 to +6. IRMAA check. When your first premium notice arrives, review for IRMAA. If you just retired and income dropped, file SSA 44 for a life-changing event appeal. Sequence any Roth conversions or large distributions after you understand the 2-year look-back for next year's IRMAA. Default rule: if uncertain at any step, enroll to stop penalty clocks. Enroll in Part B if you cannot verify active large employer primary coverage. Enroll in a low-cost Part D if you can't document creditable drug coverage. You can refine plans later. You can erase penalty months already accrued. The 5-minute decision tree. Exactly what to do next. Let's cut the overwhelm. In 5 minutes, answer 4 questions and follow the branch. If you can't verify an answer quickly, use the default. Enroll to stop penalty clocks. Question 1. How old are you relative to Medicare eligibility? If you're under 64 and a half, set reminders and skip decisions for now. If you're in your initial enrollment period, 3 months before your birthday month or 3 months after, go to question 2. If you're past that and not enrolled, skip ahead to the already late branch. Question 2. Are you covered today by an employer plan based on active employment, yours or your spouse's? If no, enroll in Part B now. If yes, go to question 3. Question 3. What's the employer size for the active coverage you're using? 20 or more employees for at least 20 weeks this year or last, or under 20? If under 20, Medicare is primary for you at 65. Enroll in Part A and Part B during your initial enrollment period. Pair with a Part D plan unless you have documented creditable drug coverage. If 20 or more, you can delay Part B while actively working. Go to question 4. Question 4. Do you have written proof that your drug coverage is creditable? If yes, you can delay Part D while that creditable coverage continues. If no, default to enrolling in a low-cost Part D plan now to avoid the 63-day penalty risk. Now the branches. Branch A. You're 65 on active large employer coverage, and you have the annual creditable drug letter. Action. Delay Part B, keep the letter, and set a reminder to request CMS L564 from HR 90 days before retirement. When you set a retirement date, file CMS 40B and CMS L564. So Part B starts the day after active coverage ends. For drugs, either keep the employer plan if it stays creditable or enroll in Part D to start immediately after it ends. Branch B. You're 65 on active large employer coverage, but you can't confirm the drug coverage is creditable in writing. Action. Enroll in a low-cost Part D plan now. Keep the employer drug benefit if you want, but Part D ensures no penalty. Revisit each fall. If you later get creditable proof, you can coordinate or switch plans. Branch C. You're 65 at a small employer under 20. Action. Enroll in Part A and Part B during your initial enrollment period. Add a Part D plan unless you have written creditable drug proof. If you want supplemental coverage, choose Medigap or Advantage on your Medicare start timeline. Do not rely on the small employer plan as primary. Branch D. You're covered by COBRA or a retiree plan. Action. Enroll in Part B now if you haven't. Those do not count as active coverage. For drugs, verify creditable status in writing. If not creditable, enroll in Part D immediately. Do not wait for the fall. Branch E. You're on a spouse's employer plan. Action depends on the spouse's employer size. If 20 or more and you're both active, you can delay Part B but still verify drug creditable status. If under 20, enroll in Part B at 65. For drugs, follow the creditable letter. Branch F. You're already late or unsure. Action. Stop both penalty clocks. Enroll in Part B at the first window. Special enrollment period if you had active large employer coverage that ended within 8 months. Otherwise, the general enrollment period. Enroll in a Part D plan now. If you lost creditable coverage within 63 days, use that special enrollment period. Start rebuilding proof. CMSL 564 from the employer, pay stubs with health deductions, ID cards with effective dates, explanations of benefits, and creditable letters. After you're enrolled, file penalty reconsiderations with supporting documents. Quick checks to keep you safe. If you can't prove active and large, assume you need Part B now. If you can't prove creditable, assume you need Part D now. If your retirement is mid-year, set Part B and D to start the day after active coverage ends. If anyone says COBRA buys you time, enroll anyway. COBRA isn't active for Part B timing. The default saves you every time. When in doubt, enroll to stop penalties, then optimize later. Real numbers. How delays compound into lifetime costs. Let's put hard numbers to this so it sticks. Start with Part B. The base Part B premium is set each year, and the penalty is 10% of that base for every full 12 months you delayed without a protected reason. That 10% is permanent. It rides on top of whatever you actually pay, including any IRMAA. As the base premium rises over time, your penalty dollars rise too. Example 1, a 1-year miss. Say you delayed a full 12 months and owe 10%. Using a base premium of $185, your penalty adds $18.50 per month. That's $222 per year. Over 20 years on Medicare, that's $4,440 in today's dollars before any inflation. But the base won't stay flat. If the base premium averages 3% growth, your penalty dollars climb each year. After 10 years, that $18.50 penalty would be roughly $24. After 20 years, about $32. You're paying for the same mistake, compounding quietly. Example 2, a 2-year miss. Now it's 20% of the base. At $185, that's $37 per month, $444 per year to start. Over 20 years with 3% base growth, the total climbs into the 5 figures. And that's just the Part B penalty. If IRMAA applies, it doesn't replace the penalty. It stacks alongside it. Now Part D. The penalty is 1% per uncovered month times the national base beneficiary premium, rounded to the nearest 10 cents. Medicare shows the base changing annually. Let's use a base of $36.78. 12 months uncovered equals a 12% penalty, about $4.41 per month added to your drug plan premium. That's $53 a year. Small? Sure, but it never ends and the base can rise. 20 months uncovered means 20%, about $7.36 per month, $88 per year to start. Over 15 or 20 years, that's hundreds to a few $1,000s for a delay you barely remember. Stacking matters. If you missed both clocks, say 1 full year on Part B and 14 months on Part D, you're adding roughly $18.50 on Part B and about 14% of the Part D base, which is roughly $5.15 every month for life. That's $23 to $24 per month at the start, over $275 per year. Add normal premium inflation, and you're north of $6,000 across retirement for a timing mistake. Let me run 3 clean scenarios you can map to your situation. Scenario A, on time enrollment. You file Part B in the first 3 months of your initial enrollment period. So coverage starts your birthday month, and you join a low-cost Part D plan because you don't have creditable drug coverage. Result, $0 in penalties. Your lifetime penalty cost is 0. That's the baseline. Scenario B, 1 year delay without protection. You miss your Part B IEP and don't qualify for a special enrollment period. You enroll the following year. That's a 10% Part B penalty for life. If you also waited 5 months past losing creditable drug coverage, the Part D penalty doesn't hit because you stayed under 63 days. Good. But if you waited 7 months, you now owe 7% of the Part D base, about $2.58 per month to start. Net effect, a permanent increase on both bills. Scenario C, multi-year miss with COBRA. You retire, take COBRA for 18 months, and assume it protects you. It doesn't for Part B. By the time you enroll, you've crossed 1 full year and part of another. That's at least 10%, possibly 20% if 2 full years elapsed. Meanwhile, the COBRA drug coverage wasn't creditable for the last plan year, and you crossed 63 days. With 10 uncovered months, your Part D penalty is about 10% of the base, around $3.68 monthly. Add those together for life, and you've built a payment you can't cancel. Now, layer IRMAA to see the real monthly impact. Suppose you're in a modest IRMAA tier, adding, say, $70 to Part B and $12 to Part D. If you also owe a 20% Part B penalty and a 14% Part D penalty, your monthly increase might look like this: $37 added to Part B from the penalty, $5 added to Part D from the penalty, plus the IRMAA surcharges. The penalties don't get reduced by IRMAA, they sit on top. Your monthly cash flow feels it immediately. A quick way to estimate your personal cost today. For Part B, take the current base premium, multiply by 10% per full delayed year, and that's your monthly penalty. For Part D, count full uncovered months after creditable coverage ended, multiply by 1% of the national base, round to the nearest 10 cents. Add those to your current premiums, then project 15 to 20 years with 2 to 4% annual growth to feel the lifetime effect. 2 final stories to lock this in. One client delayed Part B 24 months while consulting part-time at a 14-employee firm. He added a permanent 20% to Part B and a 9% Part D penalty after missing the 63-day mark once. Over his expected 22-year retirement, the penalties alone were projected at $11,000 in today's dollars. Another enrolled on time, paid $7 monthly for a barebones Part D plan while healthy, and saved thousands by avoiding any LEP. Same Medicare, different timing, opposite outcomes. The math isn't there to scare you. It's there to give you leverage. Dates and documents today prevent dollars leaking every month for the rest of your life. Picking the right Medicare pieces without overpaying. Avoiding penalties is step 1. Step 2 is picking coverage that fits so you don't feel like you're paying a penalty anyway. The goal is simple: the right medical framework, the right drug coverage, and no wasted dollars. Start with the two main paths. Path 1, original Medicare plus a Medigap plan plus a Part D drug plan. Path 2, a Medicare Advantage plan that includes drug coverage. Both can work. The difference is how you pay and how you access care. Original Medicare with Medigap is about predictability and flexibility. You keep nationwide access to any provider that takes Medicare, no referrals, and Medigap fills most of the 20% coinsurance. Your monthly cost is usually higher because you're paying for Part B, a Medigap premium, and a Part D plan. But your out-of-pocket risk is low and predictable. Medicare Advantage bundles Part A, Part B, and often Part D into one plan, usually with lower or even zero premiums. In exchange, you use the plan's network, follow referrals in many cases, and accept co-pays and an annual out-of-pocket maximum. Dental, vision, and hearing extras can be helpful, but the trade-off is managed care rules and potential network limits. Coordination with your timing matters. If you want Medigap, your best window is your 6-month Medigap open enrollment that starts when your Part B becomes effective. In that window, you can get a Medigap plan without medical underwriting in most states. Delay or miss it, and you might face health questions later. With Medicare Advantage, you can elect a plan when you first enroll in Part B and during the annual enrollment period each fall. The thing most people miss is that drug coverage must be in place regardless of which path you pick. If you choose Original Medicare plus Medigap, you still need a Part D plan unless you have creditable drug coverage elsewhere. If you go Medicare Advantage, make sure the plan includes prescription drugs. Some plans don't. Either way, confirmed drug coverage starts the day after active. Creditable coverage ends to avoid the 63-day trap. Here's the practical way to choose. First, look at your doctors and hospitals. If you have specialists you can't lose, check if they accept Medicare broadly, good for Original plus Medigap, or if they're in-network for specific Advantage plans. Second, look at your medications. Run your drug list through the Medicare Plan Finder and each plan's formulary. Filter by preferred, pharmacies, and mail order if you use it. Plans differ a lot on tiers, prior auth, and pharmacy networks. Third, compare total annual cost, not just premiums. Add premiums plus likely copays and coinsurance based on your routine care. If you're leaning Medigap, understand the letters. G is the workhorse for new enrollees, broad coverage with you paying the Part B deductible. High deductible G lowers your premium in exchange for a deductible hurdle. If you're leaning Advantage, focus on network strength in your area, the out-of-pocket maximum, the drug formulary fit, and the rules for referrals and authorizations. Timing traps to avoid while you optimize. Don't delay Part D because you're still evaluating plans. Enroll in a low-cost Part D now to stop the penalty and switch later if needed. If you're retiring mid-year, line up either your Medigap plus Part D or your Advantage plan to start the day after employer coverage ends. For Medigap, start applications 30 to 60 days before your Part B effective date, so the ID card is ready. For Advantage, submit enrollment with the correct start date and verify your doctors are in-network for that plan year. Coordination tips that save money. If your drugs are expensive, Original Medicare plus a carefully chosen Part D plan often wins because you can laser target formularies and preferred pharmacies. If your medical usage is light and your preferred providers sit inside a strong local network, Advantage can be cost-effective, especially with useful supplemental benefits. Recheck annually. Formularies, networks, and premiums change each year. Annual routine to stay sharp. Each fall, review. Are your doctors still in network if you're on Advantage? Did your drugs change tiers or require new prior auth? Is your pharmacy still preferred? Did your retiree or union plan keep creditable status? If anything shifts, use the annual enrollment period to realign. If you remember nothing else, match the framework to your care style, lock drug coverage on time, and review once a year. Overpaying happens when networks, drugs, or timing don't line up. Get those right, and your costs stay tight. Rapid recap, your no penalty checklist. Here's the no drama checklist that keeps you penalty proof. Keep it tight, keep it written, and you won't pay $1 you don't owe. Verify status and size. Confirm your coverage is based on current, active employment, yours or your spouse's. Get employer size in writing. 20 or more employees for at least 20 weeks this year or last. Under 20 means Medicare is primary at 65. Lock the drug answer. Ask, is our prescription drug coverage creditable for Medicare Part D this plan year? Get the annual creditable coverage letter each fall. Save it. Scan it. Repeat every year. Build the paper trail. For Part B, keep CMS 40B and request CMSL 564 from HR to confirm active coverage and end dates. For Part D, keep every creditable coverage notice, drug plan confirmations, and any letters verifying coverage dates. Calendar the dates. At 64 and a half, set reminders for your initial enrollment period and for fall creditable letters. 90 days before retirement, request CMSL 564, confirm end dates, and pick your Part D plan. Set Medicare Part B to start the first day after active coverage ends. Set Part D to start no later than that same day. Know the defaults. If you can't prove active and large, enroll in Part B now. If you can't prove creditable, enroll in a low-cost Part D now. Don't wait for the annual enrollment period if you lost creditable coverage. Use the special enrollment period immediately. Avoid the traps. COBRA is not active coverage for Part B timing. Don't delay Part B because you took COBRA. Retiree coverage doesn't create a Part B special enrollment period. Small employer under 20, Medicare is primary. Enroll in Part A and Part B during your IEP. On a spouse's plan, the spouse's employer size governs your Medicare coordination. Sequence smartly. Enroll first to stop penalty clocks, then optimize plans. If IRMAA shows up after retirement, consider a life-changing event appeal with SSA 44. Don't stack big tax moves in the same look-back year. You first start Medicare if you can help it. Mid-year retirement playbook. T90 days. Verify active status, employer size, and drug creditable status. Request CMSL 564. Select a Part D plan. T60 days. Submit CMS 40B with requested start month. Confirm the Part D plan start date. T30 days. Confirm employer end dates in writing. Finalize Medigap or Advantage. If applicable, scan every document. Day 1 after coverage ends. Confirm Part B and Part D are active. Call if anything isn't live. Appeal if needed. For Part B penalties, enroll first, then submit a reconsideration with CMSL 564 or alternative proof like pay stubs, EOBs, and HR emails. For Part D late penalties, file a LEP reconsideration through your Part D plan with creditable letters attached. Keep paying during review. Refunds come if you win. Quick don't forgets. If your birthday is on the 1st of the month, your IEP shifts earlier by 1 month. Adjust timing. TRICARE and VA are generally creditable for drugs. Still save the annual proof. Keep copies and submission receipts for everything. Fax confirms, upload screenshots, and mailed tracking numbers. If you remember nothing else, prove active, prove large, prove creditable, and line Medicare up to start the day after employer coverage ends. Documents and dates beat penalties every time. The core skill you learned is simple. Use dates and documents to keep continuous qualifying coverage so Medicare penalties never start. If you want this locked in, download the free no penalty checklist and decision tree linked below. Then watch my IRMAA strategy video to avoid stacking surcharges. Post your situation in the comments for a tailored deep dive in a future episode. Subscribe for more step-by-step Medicare guides.